Welcome to page 44 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The muscles of facial expression. Muscles of facial expression can be categorized into two categories: the cheerful muscles and the sad muscles. Let's start with the cheerful muscles. The Orbicularis oculi muscle, which is a sphincter muscle, which squeezes and closes off the space and doesn't allow anything inside your eye. It's called the Orbicularis oculi. The nasalis muscle here raises and flares your nostrils, lifts and scrunches your nose upward. And you can do that right now and feel what that is like. That's the nasalis muscle. The levator labii muscle, labii means lip. And so the levator labii is going to lift or raise, elevate the lip, and also the labii superioris aliquae nasi. It raises the lip and the nose. The lip and the nose. It raises both of them. Like the Elvis Presley snarl is what you get when you raise that, when you contract that muscle. Levator labii superioris is just lateral to the levator labii superioris aliquae nasi, this muscle here. And as you can tell, levator labii, it's also going to raise the lip upward, superior, upward, superioris. Next, the levator anguli oris is sort of underneath here. Levator anguli oris elevates the angle of the mouth, as in when smiling. Levator anguli oris underneath this Zygomaticus major elevates the angle of the mouth, lifting it sort of up and out. Next, the Zygomaticus major is this muscle extending from the zygomatic arch to the lateral corner of the mouth and pulling it also up and outward. The Zygomaticus minor muscle is above, also from the zygomatic arch, and elevating the mouth on that side as well. Lastly, the risorius muscle, last of the happy muscles. Risorius comes in laterally from the side and pulls your mouth sideways. The risorius muscles, and these are known as the cheerful muscles. They will generally squint the eyes and raise and elevate the mouth. The sad muscles, starting with the frontalis muscle here, named for obvious reasons. The frontal bone, attached to the frontal bone, and it raises the eyebrows and scrunches the forehead and gives you those nice wrinkles in your forehead. That's the frontalis muscle. The corrugator supercilii is this muscle here. So involved in the movement of the eyebrows as well. Probably a frowning look and an angry frowning look and scrunching your eyebrows together. The corrugator supercilii. Orbicularis oris. Oris means mouth. This is not the Orbicularis oculi. This is Orbicularis oris. And you can guess what this is. This muscle will do. It is also a sphincter muscle, closing your mouth and scrunching it down into a circular direction, closing it off and allowing nothing inside. If you're pursing your lips or not wanting anything inside your mouth, you would use your Orbicularis oris muscle. The Depressor Anguli oris is this muscle, and it's aptly named. It goes around the angle of the jaw and it goes to the angle of the mouth and depresses it. It brings it down, pulls it downward. That's why it would be said to be a sad muscle. Depressor labii inferioris would be this muscle here, also pulling the lip down. Pulling the lip down in a sad type of motion. That's the Depressor labii inferioris. The mentalis muscle also reaching up and inward and pulling down. Mentalis. And the platysma muscle is this long, flat, broad muscle. And you can contract this by pulling both of by sort of straining your neck and pulling your lips down, your bottom lip down and out. And you can feel this on your neck. You can feel this muscle contracting. That's called the platysma, long, flat muscle extending from the mandible all the way down and past the neck. It's a very superficial muscle on top of all your other muscles, on top of your clavicle, and even into your shoulder and your chest. The Buccinator muscle in here is responsible for opening and closing your mouth, changing the shape of your mouth, I should say. It's underneath the risorius muscle there, and changing the shape of your mouth as in when speaking and singing, changing the shape of your mouth to make different sounds come out of it. Buccinator. Galea aponeurotica has this sort of aponeurosis, like a big long tendon on the top of your skull, and it's attached to the occipitalis and occipitalis muscle, which is the muscle overlying the back of the skull, and also attaching to the frontalis muscle, and dealing with the expressions of surprise and raising the eyebrows, etc. And that's the occipitalis on the back. The auricular muscles, auricular, the auricle is the ear. That means the muscles that move the ear, the auricular muscles. And then the procerus muscle, tiny little muscle in between your eyes, right in here, probably having to do with squinting and frowning and other eye expressions. The procerus, the procerus muscle. And that includes the muscles of facial expression, page 44 of Anatomy Coloring Book. This is Dr. Stephen Harkins.